Today I'd like to talk about cerebral infarction and cerebral hemorrhage and their early symptoms and treatments. So let's get to it. So when I talk to people, many people have metabolic disorders such as blood pressure and blood sugar. Among these people, there are a lot of people who had taken high blood pressure and diabetes drugs without any problem. When I ask them whether they have any health concerns, most of them say they do not, and everything is well due to they are managed well with the medication that they take. In the long term, it can lead to other complications. People with high blood pressure are 4 to 5 times more likely to have a stroke than people without high blood pressure. Stroke is a disease that many people have heard of, but for many people, it is also a word that still raises questions. So let's talk about statistics. Every year, about 800,000 people have a stroke just in the United States alone. About 87% are ischemic stroke. It is a condition where blood flow to the brain is blocked by blood clots. Stroke can occur if you do not manage your health well, such as high blood pressure, diabetes, underlying heart disease, stress and diet, etc. Let's talk about the difference between stroke and cerebral hemorrhage. Many of you may be curious about the difference between a stroke and cerebral hemorrhage. Stroke consists of both cerebral infarction and cerebral hemorrhage. A cerebral infarction is when a blood vessels in the brain is blocked and brain cells die. And a cerebral hemorrhage is literally a rupture of a blood vessel in the brain. You may have heard of ischemic stroke. Ischemic stroke is a synonym for cerebral infarction. So let's talk about ischemic stroke. An ischemic stroke is a blockage of blood vessels due to insufficient supply of oxygen of nutrients to the blood vessels. Although it is said that the blood vessels is suddenly clogged, the phenomenon of gradually narrowing the inside of blood vessels, it is due to the buildup of blood clots and waste products in the blood vessels. Before you have ischemic stroke, the whole process already has begun from a long time. When blood flow is completely stopped, the brain cells that receive oxygen and nutrients from the blood vessels die within minutes. If you watch a movie or drama, you must have heard of the word called golden time. Acute cerebral infarction can be treated within 3 hours. However, this golden hour means that if a patient who arrives at the hospital within 3 hours receives treatment, the prognosis of treatment is better than that of a patient who arrives after 3 hours. That does not mean that everything goes well if you arrive within 3 hours. So let's talk about cerebral vascular infarction symptoms. The symptoms of blockage of blood vessels in the brain, a symptom of cerebral infarction, are very diverse. Speech and pronunciation disorders can occur. In more than 90% of people, the speech centers is in the left hemispheres. If the left brain function is impaired, right specific hemispheres and speech impairment may occur simultaneously. Dementia symptoms. If a stroke occurs repeatedly, intellectual abilities such as memory and judgment deteriorate. Diplopia, a stroke in the brain stem. This is accompanied by dizziness. You can experience visual impairment. A stroke occurs in the occipital lobe. At this time, the part of the field of vision is darkened, and suddenly one of your eyes goes blind. Consciousness disorder. If the symptoms of a stroke are severe or a stroke occurs in the brainstem, consciousness disorders occur. Headache. Headaches often occur when brain hemorrhage occurs. A painful headache comes on suddenly. The symptoms of blockage of a blood vessels in the stomach may seem suddenly. However, before all this major catastrophe happens, our body always sends out multiple warning signals. Therefore, I would likely to ask you gently to watch all of those before you have those very warning signals to your health. So how to check for symptoms of blockage of blood vessels in the brain? If you have a blockage in the blood vessels in your brain, or if there is someone nearby, you can check whether there are early symptoms of stroke through the following. Facial weakness. Try to smile as much as you can. If one side of your lip droops downward, a stroke should be suspected. Arm weakness. Close your eyes and try to move forward side by side. Someone can check you to see if your arm is straightened well or droops in a strange way. Speech problems. If you cannot speak clearly and speech is dull, a stroke should be suspected. time to call 911. If you see any of the above signs, time to call 911, and chances are that you have 70% of having a stroke. I recommend that you always pay attention to your health in advance so that you can quickly identify the early symptoms of stroke so that you can receive treatment before the stroke gets worse. Let's talk about cerebral infarction treatment. Once the blood vessels in the brain are blocked, brain cells are permanently damaged and dead brain cells cannot be regenerated. So what are the cerebral infarction drug treatment? Thrombolytic agents, antiplatelet agents, and anticoagulants are mainly used. Thrombolytics can be administered intravenously and arterially. The IV administration method can be used within 3 hours of onset of the stroke. IV administration has the best therapeutic effect to date. The disadvantage is that the effect cannot be confirmed immediately, and cerebral hemorrhage may sometimes occur. The effect of arterial administration can be confirmed immediately, but it takes a lot of time and manpower. Antiplatelet agents are administered orally. Usually aspirin, Plavix, Ticlate, and Platel are usually used. Anticoagulants are used in cases of cerebral infarction caused by cerebral embolism or blood vessel dissection. Let's talk about non-drug treatment of cerebral infarction. Depending on the patient, a stent can be inserted through a minimal incision to dilate the blood vessel. Alternatively, carotid endarterectomy can be performed to eliminate arteriosclerosis itself. Let's talk about cerebral hemorrhage. Cerebral hemorrhage literally means rupture of a blood vessels in the brain. Cerebral hemorrhage is divided into intraparenchymal hemorrhage and subarachnoid hemorrhage. Cerebral hemorrhage symptoms. When a brain hemorrhage occurs, symptoms such as headache, dizziness, and paralysis usually occur. Seizures and vomiting may also occur. So what are the early symptoms of cerebral hemorrhage? In case of cerebral hemorrhage, sudden collapse occurs. The patient complains of dizziness or headaches, accompanied by vomiting. You may lose consciousness with paralysis of the body. If you fall into coma, you will not be able to respond to pinching or hitting. If the coma is severe, you may face death within 24 hours. If there is a little bleeding, you may not feel any strength in the hands and feet. Speech becomes slurred and the one side of the mouth droops. In the case of subarachnoid hemorrhage, you may see warning signs of stroke a few days before you experience a stroke. You will experience headaches, dizziness, temporary paralysis. Speech and visual impairments occur. If the bleeding is light, you may complain on a severe headache. And if the bleeding is severe, unconsciousness can result in immediate death. So let's talk about nutrients to help prevent stroke. I strongly believe that the supply of nutrients is essential to overcome the factors that threaten our health. Even though modern people live in an era of abundant food, there are constantly threatened by modern disease before than ever. In particular, our body is prone to lack of quality nutrients due to stress, lifestyle, lack of exercise, incompetent health knowledge, consumption of processed foods, etc. You may find out if your body is deficient in certain nutrients through taking a hair test. And the surprising fact is that there are countless cases in which the symptoms of many diseases have been alleviated just by supplementing the insufficient nutrients. Particularly, once you experience a cerebrovascular disease, such as stroke, you may not experience a full recovery even after you go through the whole treatment. Therefore, as there is a saying that health is to keep when there is healthy, it is to check your health frequently and in advance. So let's take a look at the nutrients that can help prevent stroke. You should take multivitamins and minerals frequently, and also omega-3. Omega-3 improves blood circulation disorders and improves blood cholesterol levels. Omega-3 is unsaturated fatty acids, and it dissolves blood clots and improves blood flow by dilating blood vessels. It helps prevent cerebrovascular disorders and prevent recurrence. It helps to build strength in paralyzed hands. Vitamin C, you should take vitamin C because it strengthens the elasticity of blood vessels and prevents them from bursting. It boosts immunity in your body. It is found that vitamin C deficiency doubles the risk of stroke. Calcium and vitamin D, they promote wound healing and blood clotting. Proteins, it helps in quick recovery in case of damage to the body tissues. It is also a component of the human body and helps to strengthen the immune system. Gamma-linolenic acid. It is a representative omega-6 that helps prevent blood clots, helps prevent and treat myocardial infarction, cerebral infarction, and pulmonary infarction. Dietary fiber. It suppresses the rise in blood cholesterol levels. It binds to various body wastes, including sodium, and excretes them out of the body. It is effective in preventing cerebrovascular disorders and preventing recurrence. Coenzyme Q10. It supplies oxygen and energy for smooth blood. So I have went over cerebral infarction, cerebral hemorrhage, early symptoms, treatment methods, and nutrients help for stroke prevention. Every person has different lifestyles and metabolic activities, and recommendations may be applied differently. Therefore, people who watch this video check additional information, and the result is the responsibility of the person who sees the video. If you're currently suffering from a disease, it is strongly recommended that you consult with your doctor and make a treatment plan along with the recommended diet and nutrition therapy. So if you're tired of the all the time and burn out because of stress, or you are at risk of having cardiovascular disease, then your body needs a detox. To help you start detox quickly and easily, I prepared a checklist so you can check whether your body needs the detox. Also, I have included a detox juice recipe below, so which you can download for free. Thank you.